Let's be real, we've all lived through a public health emergency. We saw firsthand just how critical it is to have a plan. But what is the official playbook for the next one? Today, we're going to pull back the curtain on the national strategy designed to protect all of us. It's the question that probably keeps a lot of experts up at night. When the unexpected hits, who's actually in charge? What tools do we have ready to go? And how does it all come together to save lives? Well, that's exactly what we're going to break down right now.
All right, to really understand the plan, we first have to get a handle on the threats it's designed to fight. And let me tell you, in today's world, they are more diverse and more complex than they've ever been.
So first up is the one we're all, unfortunately, very familiar with: a biological threat. Just think of a brand new virus that suddenly appears and just starts racing across the globe, demanding an immediate, super coordinated response.
But this category, it's actually broader than just a natural outbreak. It also includes the pretty terrifying possibility of intentional releases, things like pathogens such as anthrax, for example. And that kind of event triggers a very specific and very urgent national defense.
Next up, we have threats that are radiological and nuclear. Now, this could be anything from a catastrophic accident at a power plant, or even the nightmare scenario of something like a dirty bomb at a major city. The health consequences would be just devastating, and we have to be ready for it. And the third major category here is chemical threats. Again, anything from a massive industrial accident to a deliberate attack. So you've got these three buckets: biological, radiological, and chemical, and each one demands a totally different strategy and a unique set of tools. Okay, so when you're facing all these potential disasters, how do you even begin to prepare? You need a playbook, right? A single authoritative guide that can coordinate the entire national effort. And guess what? That playbook exists. It's a centralized government hub called MedicalCountermeasures.gov. This is the nation's official go-to strategic guide for preparing for and responding to every single one of these emergencies. Now, at the heart of this entire strategy is a key concept: medical countermeasures. I know, it sounds a little technical, but it's actually super simple. It's just the official name for all the tools we need in an emergency: the right medicines, the critical vaccines, and all the specialized equipment to protect people. Of course, every good playbook needs a strategy team. The coaches who are designing the plays and making sure all the right resources are in the right place. So who are the people behind this whole effort? Well, the key player here is an agency called BARDA. That's the Biomedical Advanced Research and Development Authority. You can think of BARDA as the engine room for this whole operation. They're the ones driving the creation and the purchase of every one of those medical countermeasures we just talked about. So what does BARDA actually do? Well, their mission really breaks down into 4 clear steps. First, they identify potential public health threats. Then, second, they fund the innovative research needed to find solutions. Third, they guide companies through the really tough process of developing those solutions into actual products. And finally, they help build up our national stockpiles so these tools are ready to go the moment we need them.
So let's open up this playbook. What are the specific plays it contains, and what kind of tools does it actually offer to the professionals who are out there on the front lines?
So BARDA's focus areas pretty much mirror the threats we just went over: chemical, biological, and radiological, and nuclear. But check out the other 2. Influenza and emerging infectious diseases. That's all about spotting the next pandemic before it happens. And pharmaceutical infrastructure, which is about making sure we can actually make all these countermeasures quickly and at a massive scale when a crisis hits. And here's what's really cool. The website is so much more than just information. It has these incredibly practical data tools. These tools help researchers find funding, they help state planners coordinate their response strategies, and they help public health officials make critical data-driven decisions during a crisis. It basically turns the playbook from a static document into a dynamic, interactive resource. This all leads us to the most important question, right? Why does having a centralized playbook like this actually matter? What's the real-world impact? The difference is, well, it's night and day. Without a plan, a crisis response is just chaotic, it's slow, and it's inefficient. And lives get lost in all that confusion. But with this playbook, the response becomes exactly what it needs to be: coordinated, fast, and effective at protecting public health. And that is the ultimate goal, all captured by this number 1. It's about unifying all the different local, state, and federal efforts into a single, cohesive national response. One team with one plan, all working together. This quote really just gets to the heart of it all. Preparedness isn't a single action, but a sustained effort. This isn't some plan that you write once and then just stick on a shelf. No way. The playbook is a living document, and it's constantly being updated as new threats emerge and new technologies give us better ways to fight them. And that leaves us with a really critical question for the future. As threats continue to evolve, from new viruses to new kinds of threats we haven't even thought of yet, how must this playbook and our entire approach to public health security adapt to keep us all safe?
And that's all for this explainer. If you found this valuable, let us know by hitting that like button and subscribing for more deep dives. We really want to hear from you. What complex topics should we break down next? Drop your ideas in the comments below. Thanks for watching.